course. So, can you introduce yourself? Before starting the classes, I want to know who is the audience. Please. Please introduce one by one. Please unmute yourself.
Hi, I'm Dr. Arpita.
Okay. Welcome, Dr. Arpita. Good morning.
Good morning,
Where
sir.
are you working right now?
I'm from Bangalore. I'm working at Aster RV.
Okay. In the critical care department?
Yes.
Have you cleared EDIC 1 exam?
Yes.
Okay. Congratulations.
Thank you.
Next.
Good morning, sir. Sir, this is Dr. Deeksha.
Hi, Diksha. How are you?
Sir, I'm good.
Okay. So you are working in Gangaram Hospital.
Yes, sir.
Okay.
Sir, I've entered in
DRMB?
third year. Yes, sir.
Third year.
Third year. Yes, sir.
Okay. Okay. Next. I can see the name of Mahmood Farag. Please introduce
Good
yourself.
morning.
Yes, please.
Good morning.
Good morning.
I am Dr. Mahmoud Farag. I am intensivist
Okay. Where are you working right now?
in Saudi Arabia.
Saudi Arabia. Okay. So
Thank you.
welcome, Dr. Mahmood Farag, in this course. So today we are going to start EDIC 2 preparatory course. And in this course, basically, the pattern of exam is like that. There are two things. One is clinical case scenario, and another is computer-based assessment CBA. So we have divided our critical care EDIC 2 preparatory course in two parts. So 50% of the lectures dedicated for the preparation of clinical case scenarios CCS part, and sorry, and almost 50% of the lectures are dedicated for the CBA part, computer based assessment. And it has been seen that candidates are comfortable in doing the cases, or you can say clinical case scenarios, but not very much comfortable in clearing the computer-based assessment CBA stations. So we will give you enough opportunity to learn how to clear this exam, both CBA as well as CCS. So we will start with this picture in the real exam. Now there is an online exam. If you have opportunity to go through the offline exam, then definitely the picture is like this. One examiner and one candidate are sitting side by side, and computer or laptop is there. You can see the questions in that and you have to answer. So another examiner will be there, and who is holding the iPad, and he or she will take the responses, whether you have given the right responses or wrong responses. So he or she will the mark in the iPad. Okay. If you have any query, you can stop me anywhere and you can ask. Okay. So what is the EDIC 2 exam pattern? There are 3 to 4 clinical case scenarios, because now earlier there was only 3 long cases, but now there are 2 long and 2 short cases. So they have divided case number 2 into 2 parts. One is 2A and another is 2B. So now there are 4 cases to be discussed in the exam. One is long case number 1, and there are 2 short cases, 2A, 2B, and then third long case 3. So basically there are 4 cases, 2 long and 2 short nowadays. It may be different also. So don't be surprises if they ask 3 long cases or 2 long or 2 short cases in the exam. So be prepared for that. And one case contains 3 to 5 vignettes or domains, and each vignette or domain contains 3 to 5 questions. So total 15 to 20 questions per case. And there is a 3 computer-based assessment stations. One is imaging, another is curves, and third is biochemistry. So in each station, there is 8 to 12 slides, and you will get 1 to 2 questions per slide. Suppose they have shown you one ECG. So they will ask, what is the diagnosis? Question number 1. And they will ask second question, what will you do? You will go for PTCA or thrombolysis, whatever, depending on the question. So they will ask 1 or 2 questions per slide. Suppose they have shown you an imaging of a SDH. Then they will ask, what is the image showing? And second question, how will you proceed here from here? So for surgery or conservative management, you have to tell the answer. So total 12 to 15 questions in these three in one station, and there are 3 such type of stations will be in the exam. No negative markings for the wrong answers. So you can say anything which comes in your mind, because they have to tick the answer. If you have given 5 or 6 differential diagnosis, suppose they have asked what is the differential diagnosis, and in their iPad only 2 or 3 are there, they will tick those 2 or 3 differential diagnosis as a positive, and there is no negative or positive marking for the answers given by you, which is not in their iPads. Okay. So overall, there is no negative marking for the wrong answer. So try to speak as much as possible, because you never know what are the points written in their iPad, and they have to check those boxes in front of the responses. So you have to be quick, and you have to be more responses. You have to give more responses so that they can take as much as boxes possible. Some of the points you obtained from or all 3 or 4 CCS CBS cases calculated. So ultimately they will calculate all the responses given in the CCS as well as CBA, and then the final marks will be there. To pass EDIC 2, your score must exceed pass mark as determined by borderline regression method. So basically, they make a cutoff for each and every exam, and then you have to cross that benchmark to pass the exam, and you have to independently pass in both CCS as well as CBA. So clinical case scenario as well as computer-based assessment, in both type of exams, you have to be independently pass. So candidate has to pass 2 CCS and 2 CBA to clear the exam. So at least among 3 stations, you have to pass 2 stations, and among 3 long cases, you have to pass at least 2 cases to clear the exam. And nowadays they are taking the exam on EDIC 2 exam on 2 different days. On day 1, they will ask you only CCS part. On day 2, they will ask you only CBA part. So nowadays they are asking because they have a scarcity of the examiners. That's why they have divided the exam into 2 days, online exam. Okay, so be prepared for that. How to go through clinical case scenarios. The aim is to test your intensive care medicine knowledge and decision making in clinical situations based on real life patient cases. All clinical case scenario are the real patients. All examiners are the real intensivist. So they will understand whether you are saying something in a different way, but they will understand. So don't worry, they are not the non-medicos, or they are not from the different field. They are intensivists who work in ICU day in, day out. So if you try to say anything which is not exactly same written in their iPads, they will give you marks because they are understanding what you want to say, because they are real intensivist. Introductory vignette extract from patient's notes is given before exam, 30 minutes to prepare 3 to 4 cases. So in every clinical case scenario, or you can say long cases, they will give you an introductory vignette. So basically, this is the summary or patient notes extracts which is given before exam. So they will give you around 10 minutes for each case. So total 30 minutes for 3 cases. Then context. So context is an emergency room in a large teaching hospital. So imagine you are working as a resident or as a doctor in an emergency room in a large teaching hospital or tertiary care corporate hospital. So basically, you have to understand, you have to put yourself in those shoes that you are in the working in emergency. So they will ask you, a patient came in emergency, how will you proceed? Because they are imaging you like you are a resident in the ER. Then brief past medical history, presenting complaint situation, and finding physical examination, imaging, blood samples, ECG. So what are the CCS preparation tips? You will be given all 3 or 4 introductory vignettes at the same time. Preparation time is 30 minutes. So roughly 10 minutes each to read the introductory vignette. It is advisable to notice the order of your case during examination and prepare them in opposite order. So because which is first case, you should prepare at that case in the last, so that you should be ready for that case. Otherwise, you have to remember the first case because you are prepared in that order. So you have to prepare the case. You have to write the points of that particular case in last, which you are going to face first. Then first question is usually, can you summarize the case, or what is your differential diagnosis? So in every case, the first question will be the same. Can you summarize the case, or what is your differential diagnosis? And sometimes we may when they ask, can you summarize the case, we start reading the introductory vignette. So they are not asking you to read the introductory vignette. They are asking the salient features or salient points in that introductory vignette. You need not to read the same introductory vignette which they have given you. During the preparation, you can make notes either on the vignette itself or on a spare paper. You are allowed to take your notes into the exam room and use it during the exam. So this is for the offline exam, but for the online exam, you have to be given pen and paper. Basically, you are giving the exam from your home. So they will allow you to carry at least few papers and pen so that you can read and write those important points, because they will give you 3 introductory vignettes for the 3 cases. So you can point out the important things. A laminated table of normal values of blood chemistry is available during preparation, and data are given in both traditional and SI units. So need not to worry to convert the units from kilopascal to millimeter mercury or so on in the exam, because they will give you values in both units, traditional as well as SI units. CCS example. In general, one CCS is usually a medical patient, one is surgical, and third one may be some sort of emergency like obstetric case with breathing difficulty, or burn or some neurotrauma or drowning or post CPR survivor. So in the three cases, one case will be from medical background, one from surgical background, and one from emergency background. So you should prepare in that way. Then candidate cannot go back to old questions in CCS, because in CCS they will not allow you to go back. Suppose they are asking why patient is not able to wean. So you said there is a fluid overload, or suppose patient is on fluid overload, a CKD patient, there is a requirement of dialysis, you are not saying the dialysis, then in the next weekend they will show you that this patient has gone for the dialysis. So they will not allow you to go back to the old question, because they have given the answer if you are not able to give the answer. So that's why this is not possible to go back to the old question in CCS. But in CBA, they will allow you. Suppose in the imaging station, there are 10 to 12 images of the CT, chest X-ray, ultrasound, echo, whatever. So if you complete your exam within the stipulated time, suppose you have completed exam in 8 minutes and they have provided you 10 minutes. So in last 2 minutes, they will ask you, do you want to go back to the any question? So if you are facing difficulty in giving answer to some CBA question, so you can go back to that question in your spare time. But if time is already completed, then there is no point. Obviously, they will not allow you. If you have spare time, then only you can go back in the CBA part, but not in the CCS part. Okay. Abnormal values will be marked in red. Try to quote any study related to topic on which question is asked. After the case is over 5 minutes, both examiner agree on which points to give and actual marking, and this will include a general performance score for the candidate. So basically this is for the marking part. So how they both examiner agree to give you marks. Sometimes there may be confusion over whether you said this thing or not, or you mean it or not. So they both agree on the same thing, and then they will give you marks. Or if you want to quote any study related to topic, you can quote, but usually studies are not discussed in the exam. They are discussing only the practical points. Will you, how will you approach? What will you do? They are not discussing the theory part, and they are not discussing the studies in the exam. Then CBA stations, curve 1. So station number 1, this is a curve station. So in curve station, there are 2 to 4 ECGs, 6 to 8 screen, which contains the ventilator and monitor photographs. Screen are generally focused on testing the pattern recognition and some physiology. So usually the monitor and ventilator screen are shown, which have some different type of pattern, or some usually some pathology is there. So you have to try to find out, and there must be some physiological rationale to those things also. For the ECG part, they will ask ECG based on some anatomy and physiology of heart and cardiovascular system. Principles of ECG monitoring: heart rate, rhythm, conduction, ST segment changes, and QT interval, advantage and disadvantage. Identify deviation from the normal range, interpret those in context of clinical circumstances. Identify abnormalities requiring urgent intervention. This line is very important. Usually in these curves or some CBA stations, they are used give you situation which requires some urgent intervention. So they will ask you what is the problem and what will you do. So you have to identify the problem, and you have to tell them what urgent intervention is required in that particular situation. Then differentiate real changes from artifacts and respond appropriately. Document investigations